Thanks very much indeed, John. So I'm going to be presenting together with Monica Fletcher, our partnerships lead, and really pleased to have this opportunity and delighted that a number of our Breathe colleagues are in the room today. So this is what we've got planned. We want to talk about, the team a bit, what our original mission was, that original plan, and how we think we've made really quite substantive progress in that respect. We had a strategic pivot. We've heard this kind of repeatedly over the course of a day, but I'll kind of illustrate what we've been trying to do in that respect. And I'm going to hand it over to Mon to talk about the industry forum. That's a really kind of thriving entity that we've created, and then where we're hoping to go moving forward. So an absolutely fantastic team. It's a distributed network that we've got. So partners from across the UK, and our patient and public involvement leads have been absolutely fantastic. So we've got Alex and Anthony, who's in the room. So they've led a kind of a consortia of PPI members. We've got Gillian Beggs in the room as well. A lot of industry and third sector and other public partners. So we're presenting on behalf of this team. So our original mission was that respiratory disorders are incredibly common, complex, responsible for substantial morbidity and mortality. Absolutely fantastic data sets that we've got in the UK, but really these were pretty untapped, and what we were trying to do is make these data much more accessible, available in more hands really, to try and support the drive to improve respiratory outcomes across the UK. We organised our work into three themes, so drug development and pharmacogenetics, led by Martin Tobin and Ian Hall, real-world evidence, led by Jenny Quint and Chris Groves, and also data-enabled trials. John Norrie and myself were driving that forward. So in terms of the drug development and pharmacogenomics, Martin and Ian have worked primarily with the EXCEED and GASP cohort, so a lot of work around identifying new genomic signals, new biomarkers, risk stratification, working across a range of respiratory disorders. A number of industry partners there, and that work, I think, has been led to kind of a number of insights really that are being taken forward through, for example, drug repurposing activities. So really pleased to see how that work has developed. In terms of real-world evidence, we've put over 130 respiratory data sets into the gateway. These are national and international data sets. There's been a lot of work that Jenny in particular has led on how to really create reproducible data assets. So working on asthma, COPD, and ILD in the first instance. So working to create phenotypic definitions. So this is now in the phenomics library. Agreed code list, because there's a lot of heterogeneity, inappropriate heterogeneity in the way these data have tended to be mined. So we're trying to standardize that effort. And then really standardizing approaches to data curation. We've been trying to work across trusted research environments across the UK. And then working with Diveplane to try and create synthetic data sets to try and really lower the barrier to entry for industry partners in this space. In terms of data-enabled clinical trials, the one that we've really tried to, wanted to kind of mention here is the Coronavit trial. So this is led by Adrian Martineau at Queen Mary's, part of the Covidence UK cohort. So this is a UK-wide cohort, and so using a Twix design, so a trials embedded within a cohort design, we've had this Coronavit trial. So over 6,000 people randomized to try and identify those with vitamin D deficiency, a test and treat approach. So this is a trial delivered in the community to see whether that can reduce the incidence of respiratory tract infections. And what we've been able to do is look at things like hospitalizations and mortality endpoints by linking with routine data across trusted research environments, and Cell Data Bank has been absolutely pivotal in doing that. So a large, important trial for the UK, but really driving efficiencies as a result of those data linkage considerations. So that's reported as a preprint at the moment, and it's just we're just working on revisions for the BMJ, so hopefully that will be out soon. So our pivot to lockdown, to COVID, was very early on. So I had this discussion with Caroline Cake and Andrew Morris, and really we saw back in February 2020 was coming down the tracks, and so we pivoted wholesale really to try and support that national effort. And we thought that was only appropriate given that we are the kind of respiratory data hub for the UK. So Sir Patrick mentioned the challenges with lack of access to ready data to support sort of really important decisions that needed to be taken for the UK. And so what we tried to do was try and support and create national data assets. So we did this by sort of augmenting the UKRI supported EVE2 platform in Scotland, but then also did this to try and do this or scale up efforts across the UK, building on sort of an initial investment from the National Core Studies data and connectivity. Lots of partners from across the UK as we were trying to support this effort. So what we've been able to do really for Scotland was to create the first real-time longitudinal cohort for the entire country. Really, that's never been able to be done in the UK, so that I think has been really important. We've done that for the UK as well, partnering, so working across all UK nations, and I think that's been, again, a first for the UK. Fundamentally, this has been trying to support the national effort. So reports going into COVID advisory groups, the Scottish Government Resilience Room, so that's the equivalent of COBRA, chaired by the First Minister. At a UK level, SPI-M, JCVI, MHRA, etc., you name it, we've been sort of presenting at these meetings. But also, a lot of work with WHO, supporting them because quite a few of the insights that we were generating were the first in the world. So just briefly, some of the things that we've been able to do, and they're summarized on this slide. So these were amongst the world's first analyses looking at real-world effectiveness of vaccines. For example, increased severity of Delta, reduced severity associated with Omicron, for example. So a number of these analyses that have been provisioned to government entities in as close to as real time as possible to enable sort of important decisions that needed to be taken. I think this work has been recognised by sort of senior decision makers, and I think it's been important for the UK and I think globally as well. There's been a lot of work with the media. So Rory mentioned that we've got absolutely fantastic health and science correspondents. Got to know quite a few of these guys because really in these stories there was no margin for error, so we wanted to get this absolutely right. There's lots of ongoing work. So we had a meeting yesterday. There's actually 18 analyses that we're working on, just a flavour of what's going on. So analyses that are coming down the track because unfortunately we've still got COVID, even though sort of politically I think people would like to move on.